So some students' concerns about gap years are that it'll actually disadvantage them in their application. What are your thoughts on this?
I don't think it will disadvantage them at all. I suspect some medical schools quite like students to have a gap year. It just gives them another year to mature before they start. My primary advice to anyone considering a gap year is that they should have fun. Some institutions will expect perhaps a slightly more serious approach and that expect that you would have gone abroad and perhaps been involved in some kind of medical or charitable work overseas. But that's not essential. Many students, I think, can find projects through the various organisations that identify gap year placements. And of course, it may be that someone would like to work for half the year and then fund travel. And travel broadens the mind, and even if you're not doing medical or charitable work, I think you can still learn a lot by visiting other parts of the world.
Okay. If somebody was to go on a gap year, another concern is in terms of their academic studies. What kind of tips and advice do you have in terms of that?
I can say absolutely that throughout my career teaching medical students, I have never found a student who couldn't get back into the academic groove after a gap year. In fact, if anything, they are even keener than the other students because they've been away from studying for a year.